Welcome back. Last week we talked about reasons why you would want to increase your GLP-1 dose, and today we're going to talk about reasons why you might want to decrease your GLP-1 dose. My name is Dr. Lindsay Ogle, and I'm a board-certified obesity medicine physician. And many of my patients are on GLP-1 medications, so I help them titrate their dose over the course of their treatment during initiation, maintenance, and if we are considering titrating off of a GLP-1 once we've reached our goals or for other reasons. So this is something that I have a lot of experience with, and as I mentioned last week, it is very nuanced. So there's not a set schedule that someone should be on. There's not a algorithm that you can follow exactly. This is something that really needs to be individualized between you and your physician. And so I say that to take all this information with a grain of salt, and I hope that going over these certain decision trees help to highlight the nuance of prescribing GLP-1 medications. And if you are not getting this nuanced discussion with your physician or your prescriber, then consider looking for somebody who is taking all of these factors into account. So as I mentioned last week, I always go over side effects with my patients because many people do have side effects on GLP-1 medications. By far, the most common are GI-related side effects related to the slowing of the emptying of the stomach. So that could lead to nausea, indigestion, acid reflux, constipation. It can also lead to loose stools and diarrhea, bloating. Some people may also have more of the atypical side effects like fatigue or mood changes or like a pins and needles sensation, headache. There are a few other side effects that may occur. So if you are experiencing anything new when you start or titrate a GLP-1 medication, bring that back to your doctor and let them know. If it is significant or severe, or I would say even moderate, reach out to them between appointments. But if it's more mild, you can save it until your next appointment with them, which should at least be monthly in the beginning, but usually no longer than every 3 months, checking in with your doctor. As I mentioned last week, if you're having mild side effects, then you could at the very least stay at that current dose. You don't necessarily need to go down on your dose, but if you're having more moderate and definitely severe side effects, then maybe we need to back off on your dose for at least a little bit of time to allow your body to adjust to being on a GLP-1 medication, as well as having the opportunity to focus on lifestyle modifications to mitigate those side effects, because much of the side effects can be mitigated through adjustments in hydration, nutrition, and timing of meals. And I have talked about these GI side effects in prior podcasts and YouTube videos, which I will link below so you can check out to go into more depth about those side effects and how to manage them. But if you are having moderate and definitely severe side effects, then you should either reduce your dose or maybe take a break from your GLP-1 for a moment in time. Last week, we also talked about appetite. And if your appetite is very suppressed and you find it difficult to eat meals or even have snacks throughout the day, then that dose is too high for you and you need to let your doctor know, because you should either stop your GLP-1 or decrease your dose. The goal of these medications is to control appetite and bring it back to a steady state, or what would be considered a normal appetite, rather than dysregulated appetite. People living with obesity have increased hunger, and that can either be the primary cause of obesity or it could be related to the obesity itself. And it leads to a feedback loop that can then promote continued obesity. Medications in the past that we had to treat obesity really focus on appetite suppression And GLP-1 medications also suppress appetite and control food noise and cravings. And that's one of the ways that they work. And that's very helpful and can help to ensure that a healthy nutrition plan is followed and we're able to more easily eat smaller portions or appropriate portions. But we do not want to suppress the appetite to the point of skipping meals or having prolonged fasting or having severe caloric restriction, because that's disordered eating. And these medications are not supporting disordered eating. That is inappropriate use of these medications. And in addition to that disordered eating, it can lead to nutritional deficiencies, loss of muscle, fatigue. It can also decrease your metabolism, which is very difficult to overcome once that's occurred. It can also lead to hair loss down the line. There are many, many negative side effects, both immediate and in the future, from excessive restriction. So we do not want to suppress that appetite. We want to control it. So if your appetite is too suppressed, let your doctor know, and maybe you need to reduce your dose. Another thing to consider is if you are rapidly losing weight. And typically that would also correlate with the overly suppressed appetite, but not always. And if you are experiencing rapid weight loss, and that is on average more than 2 pounds per week, then you want to talk to your doctor about that, because rapid weight loss also has negative consequences. Some of it is similar to the decreased nutrition, and it could lead to decreased muscle loss, which can then in turn in the future lead to decreased metabolism and decreased functional capacity. But it also can lead to other complications like gallbladder disease, which can be very problematic, especially if not caught or managed. For many people, it can also be linked with dehydration, which can lead to issues with kidney function. So we do not want to lose weight too rapidly. We are looking at long-term health, and to achieve that, then we want to have a slower or moderate weight loss over time and set ourselves up to have the ability to maintain that weight loss in a healthful way. Another time we consider reducing our dose is when we've reached our health goals. And so you could be on a GLP-1 medication for the treatment of obesity. Most of my patients are, but some of my patients are on it for type 2 diabetes or other metabolic conditions. And once those conditions are controlled, then we can consider reducing the dose. And we want to do this in a very controlled and monitored fashion, because if we cut back on the dose and we would just go down to that, next lowest dose, then we want to monitor your response. If you are having increased hunger, decreased fullness, increased food noise, blood sugars going up, then we realize that we can't go down to that lower dose and we need to go back up to that higher dose. But if you're doing very well at that next lowest dose, then let's stay there and we'll continue that for a period of time, typically another couple of months. And then we can reassess if we want to then try the next lowest dose. And again, reassess with those similar parameters. And we can continue to do that over time. This is something that I think about a little bit more for my patients who do not have insurance coverage for their GLP-1 medications and they're paying for their medication out of pocket. And I want to be really sensitive to the amount of money that they're spending each month for their treatment. And so if we can maintain their health long-term on a lower dose or maybe less frequent dosing, then I want to try to find the lowest dose possible for them that's effective. For my patients who do have insurance coverage, this isn't as much of a factor, but I still, my philosophy with treating patients is we want to be on the lowest effective dose possible to mitigate and lower chances of having side effects long term. And so we still might try this in the right patient, but again, with close monitoring. And I want to highlight that if you are not able to go on a lower dose or go off of your GLP-1, that does not mean that you're failing or doing anything wrong. Studies consistently show that most people need to continue the GLP-1 medication long-term for maintenance of either their obesity or their metabolic disease. But there are a subset of people who are able to go off, and we don't know exactly why that is. Obesity and insulin resistance and type 2 diabetes are multifactorial. There are genetic components, environmental components. It also takes into account how long you have had obesity or your metabolic condition. And so do not blame yourself if you're not able to reduce or stop your medication. It's not in your control. So work with your doctor, find what is best for you. But those are some of the reasons why I would reduce the dose of someone's GLP-1 medication. I hope you found this helpful. If you have any questions, please let me know, and I will see you next week. Take care.